Well, good morning, everyone. Welcome to our career chat today. We are focused on physical therapy, the health career pathway, and our guest is Pat McCloskey, and he is a physical therapist here in Grand Rapids at one of the Hulse Jepson locations in Cascade. And Pat has been a longtime supporter of the career readiness programming. So welcome, Pat. We're so glad you're here today.
Yeah, thanks for having me. That's awesome.
So as we spend this next 30 minutes together, we're going to try to dig into your own personal story a little bit and then really hearing about your job too. And the students are going to have a chance to ask questions. So really, I'd like to take you back to when you were a high school student, 16 or 17 years old. Did you think you'd be a physical therapist? Kind of what were you thinking at the time, and kind of how did you land to where you are?
Yeah, that's a great question. So when I was in high school, I played a lot of sports. I played football, basketball, baseball, so I was very into sports. So I talked to our high school had an athletic trainer, so I kind of got an idea of what he was doing. I said, this seems pretty cool. Like, you get to work with athletes, you watch sports, you do the rehabs, things like that. So I was into that. So I went and did that as my undergrad. So my undergrad degree is actually in athletic training. And then in doing that, I kind of got a love for like the rehab part of it. I like seeing patients go from either from surgery or from injury and then bringing them all the way back to kind of accomplishing their goal. So after working in athletic training for a few years, I kind of decided, okay, I think it's time to get into physical therapy. So I, bit the bullet and went back to school and finished and did the 3 years of PT. So yeah, this is kind of the path when I was in high school that I think I was going to end up on. But, I'm really glad that it did work out this way because I love it.
Was there some athletic training that kind of attracted you? Was it the athletics piece? Because I know some young people start to decide, like, how do I decide between physical therapy or occupational therapy, some of the other therapies, and we can get into some of those if we have time. But
Yeah.
was it kind of the athletic side of it is what you liked about it at first?
Yeah. Sorry. Yeah, it was definitely the athletics part of it. I wanted to stay involved in sports. I couldn't see myself sitting in an office all day. I like, moving around, getting up, things like that. And I wanted to stay connected and really like, as a teenager, I was just very interested in sports. And I thought, this is kind of a good segue. I like using my hands, being hands-on with things. And I just like the way PT is in athletic training. It's like, you're working with the body, everything's in front of you. It's kind of easy to see and get an idea, a picture in your head of what's going on. So yeah, I really like the sports avenue is kind of the way that I got into this. And a lot of like my coworkers, they got into it because they had to go to physical therapy, whether they got hurt in a sport in high school or in college. That's how they got into it as well.
Yeah, I have noticed that when I've talked to young people who are thinking about physical therapy, and often it has been because they had an injury themselves and really connected with their physical therapist and thought that was a pretty cool job. So that's great. So some of your colleagues, what are some of the other undergrads? Because I think a lot of young people might not know that doesn't have to be a certain thing to become a physical therapist. What are some of the other undergrad degrees as these young people are figuring out their next steps?
Yeah, that's a great question. So athletic training, exercise science, we have a lot of kids that were in my class for physical therapy were psychology majors, biology majors, pre-med, and just decided that PT was the route that they wanted to take. And really, you're not limited in your bachelor's degree in getting into PT school. Basically, all you have to do, not all you have to do, but what you have to do is make sure you take your prerequisite courses, which each physical therapy school will lay out. It's usually chemistries, physics, biologies, courses like that will help kind of prepare you for it. So as long as you're in some sort of medical field, you can do that. I also had one friend who worked in business, was a business major, decided they didn't like it. So she went back to community college for a year, took all her prerequisite courses, and then ended up in physical therapy school. So it's pretty flexible.
Yeah, I think that's really important for the young people who are in attendance today to understand that you don't have to have it all figured out right now. That you can get a certain undergrad, because that is going to be the next level of education to actually become the physical therapist. And like you said, it's really researching those physical therapy schools and finding out what their prereqs are and making sure those are part of it. So hopefully that helps our young people just take a breath and know that, I don't have to have it all figured out, that this is part of the long-term goal. So is it a doctorate? Is that what I hear now to get your physical therapy degree?
Yeah, so it's a doctorate. So it's 3 years after graduate school. Yeah, and probably a year to a year and a half of that is built up of like clinical time where you're doing internships and things like that. Yeah.
And I definitely want to dig more into your internships and stuff. I know a lot of young people would love to hear just from your perspective, though, what a typical day is like. What is it that you do every day as a physical therapist?
Yeah.
And what myths might be there? What kind of myths might be around that too?
Yeah, so there are different types of physical therapy, being like hospital setting, school setting. I work in outpatient orthopedics, which is probably the most common, the one people see, in commercials or on TV or when you drive by. So we see mostly like musculoskeletal stuff. So if it's either like surgical cases, like a knee replacement or an ACL repair, or someone who just has back pain or neck pain from a car accident. So really, during your typical day, like you don't really know what's quite walking through your door, especially if it's a new patient. So I work 3 10-hour days and 2 5-hour days. That's kind of how we spread it out. So each day, for the most part, we spend the majority or as much as we can working with the patient one-on-one. So if it's an initial patient, we'll see them, we'll run through the full evaluation. And then we'll make what's called a plan of care. And that's where we decide, okay, this is what this patient needs. So if it's these type of exercises, this type of hands-on therapy. So each patient's therapy is pretty much broken down. We do about half where they're doing exercises or movement-based stuff. And then the other half they're working with me, whether it's either massage, stretching, mobilizations, things like that, to help get them back to their goal. And then other things, obviously, each patient, they need documented a daily note. So we have to do a note on each patient, which basically runs through, they tell me how they're feeling, I document that. We document what they did throughout their session, how they responded to it, and then we kind of make a plan for the next session. So those are kind of the big things through the day. And then there's obviously emails, looking through insurance to make sure that the patient is being covered to come into therapy, things like that.
So it sounds like a nice variety, and it's probably something you like about your day. Like you say, you never kind of know what's going to be coming in the door. Is that part of the thrill for you? It's like, what's going to happen today? It's not all prescribed.
Right. Yeah, it's great. Because you can spend, I mean, if it's a day where, I have a lot of people I need to be out in the gym, I'll spend 90% of my day in the gym, and then, I'll run in at lunchtime and do my notes. And I don't care, because I love being out there bouncing around from patient to patient and treating them. And then, you could see there are some patients, they'll come in and say they have, knee pain, and then you go through your assessment and you figure out that it's actually coming from their back or something like that. And it, like, just a big light bulb comes on in their head, and it's pretty cool to see that. And when you can identify something like that.
Yeah, I would imagine that you're a hero to a lot of people, because you like literally help take their pain away. Is that?
Yeah, that's one of the most. I'm sorry.
No, is that a piece of this for you, that you get to help people in that way?
Yeah, I think like being able to take someone where, people are coming in here because, they're hurt, they're in pain, something's not doing well, or they can't do something. They can't play golf. They can't pick up their grandchildren. They can't go for a walk or a run, and being able to help them achieve their goal and kind of point them in the right direction is pretty cool. That's that's the biggest thrill I get from the job, for sure.
So looking at your education, and I'm sure students will have more questions about your day-to-day, what was the actual schooling like? And that internship that you mentioned, is that something that you pursued yourself? Did your school help you? I want them to understand that they maybe have to be the one to take some initiative on some of this, help them understand some of the steps along that education route.
Yeah, so the school, while you're in school, the school they will let you know how many internships you need, and in what areas of physical therapy. And then generally they'll have a list of, okay, these are the companies or the hospitals that we partner with. But for my school, we are also welcome to go out and do some on our own. So like in my physical therapy school, we had 4 clinical rotations. One had to be in a hospital. So I worked with like cardiac patients who got like pacemakers put in, things like that. One, I worked in a nursing home, so helping people try to get out of the nursing home and to their home. I did one in this setting, like an orthopedic. And then the last one I set up by myself, I did with a Major League Baseball team, the Indians, at their spring training site. So that was one where I was really passionate about sports. I wanted to see what it was like. So I went and set that one up on my own.
And I love that you just gave such a great broad look at where physical therapists can work, that there are so many different environments, right? Even with, I know we have our own physical therapist at the Kent ISD to serve students in Kent County. So for the students that are in attendance today, know that it's just, there's so many opportunities that PT umbrella just can take you to many different places, right?
Yeah.
That's so great. And how did you find that one at the Indians? Like, was that networking, or how did you find that?
Yeah, that was networking. Like, I was fortunate with my undergrad and athletic training that I got to meet a lot of other athletic trainers, and someone I met with that later on down the line, he became the head physical therapist and athletic trainer for the Indians. So I contacted him and said, hey, like, what do you think about me coming out? And he was into it. And yeah, so it was just kind of keeping up with people that I had met along the way. So even, you know, if you go and do like shadowing or volunteer work, you know, and they give you their card, like I give my card out and my email to everyone who comes in here. And, you know, if you contact me, like, I'll get back to you, and like, you can use me as a reference, or, you know, I can help guide you along the way for sure.
I hope the young people realize what gold that is. And I will share Pat's email as we finish up, because he has wants to make that available for you guys. So yes, networking is so important, keeping track of those people along the way. Obviously, college debt is a big deal for a lot of these young people as they look forward to their school. And there's a question like, how many years were you in school total then? And then how did that, what was that big bill at the end? And are there maybe ways that you can recommend to kind of break that up for young people?
Sure. Yeah, so I did, mine was a little non-traditional. So I did the 4-year bachelor's degree. And then I was working as an athletic trainer at a college. So I did a master's degree in public administration. So I wanted to take some business courses in case I ever became a manager of a clinic. So that one was actually free because I was working at the college. So that was helpful. And then I did the physical therapy school is 3 years. So for most PTs, they do 7 years total. It's 4 years for the undergrad and 3 years for grad school. I would advise now, I mean, it is pretty steep, especially PT school is costly. I would say the average coming out of school, I would say I was about 120 or 150,000 in debt with school loans coming out. And most of those were from PT school. And that's because, you know, we were in school full time. I didn't have a lot of time to work, so I had to take out some money for living expenses. But I also then moved back home with my parents. I was 28 years old and said, save some money, I'm going to move home. So I didn't have to pay rent, things like that. I worked at the school that I was in PT school as an athletic trainer. So I got to do some things there that helped pay it down. And then there are other options. As far as, you know, there are grants out there are scholarships out there that you can look for. I think a lot of people now go into maybe an undergrad, do 2 years at a community college where you're going to pay a lot less to get your bachelor's degree started is very helpful. And then some companies, when you sign on for them, they'll help pay for some of your loan to pay some of that down. I know I have a friend who he went into the Navy and became a physical therapist in the Navy, and they paid, I think, half of his student loans off if he, you know, signed on for a few years.
Yeah, those are some great suggestions for sure. Because I know as young people, you know, going off to that 4-year school is a really big deal. But man, if you can cut that first 2 years and stay at a community college, you're saving, I know my daughter alone, she saved $32,000 by going to community college the first 2 years. So yeah, when you look at the big picture, and the fact that you worked at a college, so you got some of those classes free, those are some strategies that young people may not even know, that you can get free classes if you work at a college, if you're a full-time staff person. But that physical therapists also make a decent wage that you can then start pay those back. I guess I want young people to understand that too. What would you like to tell them about that?
Yeah, and that was part of my switching from athletic training to physical therapy. I was an athletic trainer. I was an assistant at a Division I school, a fairly major school, and I was making $35,000 a year. And I don't know that I could have got much higher unless I worked in professional sports, which those are higher salary. And then when I came out of physical therapy school, my salary was double immediately. So that's really helps pay the loans down when you're making a decent wage. So PTs nowadays, I think, start out around 65, 68,000 a year, which is a good salary.
Yeah, and if not more, I think actually the averages that they actually earn per year is even higher now.
Yeah, wow.
Overall is the average. So yeah, for young people to know that you do take the student loans out, but that you are getting a pretty decent wage to start paying them back. But there are a lot of hospitals that have tuition reimbursement. So again, working in a hospital while you're getting your schooling, at least for those first part of it, can be a money saver too.
Yeah.
So one of our students wants to know, kind of, if you could share a little bit about what it was like to be an athletic trainer, and what was that little inkling in you besides the money? Obviously you want to make more money, but was there something else you're like, I want to take this to the next level? What was some of that thinking that you had at the time?
So athletic training was awesome. I loved it. So I worked at a college. We basically had a team in the fall. So I had a soccer, usually it was soccer in the fall, then lacrosse in the spring. And basically you're with them for what they do. So I'd come in the mornings, and then that's when we would do the rehab. So if a kid had an hour break in between a class, they would come in. If they were injured, they would do the rehab and then go back to their class. And everything was great because everything was on campus. And then at the end, at whatever time the team practiced, they would come in an hour before, get prepared. So you do your taping, your heating, bracing, stretching, and then go out to practice with them. When they're done practice, whatever is necessary as far as icing and getting them kind of shut down for the day. And then, a lot of traveling. So I've been to a lot of places, but I don't know that I've seen a lot of places because we're in the hotel and then we go play the games and then we leave. But it was a lot of fun. I mean, high energy. I mean, it was great to kind of keep moving. I like to say it was kind of a young person's job because it was 7 days a week. If you think about when sports are played, they're on, the weekends, they're at night. So I would go start in August and then I wouldn't get a day off until after Thanksgiving, Christmas. And then you get a couple of weeks off and then you're back again for 3 months. So it was a big commitment. I think that was one of the big reasons for changing to PT, was just the time involved. Like I knew as I got older, I wanted to start a family. I wanted to have normal hours, which was important to me. But I like doing the rehab aspect of it. So when the kids would come in the morning to rehab, like before class or, when they had a break class, that was the fun part, getting able to help them out and see them translate it to being able to play. That was kind of the best part of it for me.
Yeah, it sounds just the sparkle in your eye. You can tell you really enjoyed that season of your life. But
Yeah,
like you say, the hours and it just starts to wear. And I'm impressed that you took that extra schooling on because obviously you're really busy at that point, but you're like, that internal motivation helped you push to the next level. Yeah. So good for you. What would be some of those personal qualities that make a good physical therapist?
I think for sure, like communication really is the biggest part of it. I mean, the way you can talk and interact with a patient. I mean, one time I'll have a 3-year-old or a 5-year-old come in here. Maybe they broke their ankle and they just need help kind of learning how to re-walk again or some motor stuff. And then we'll have an 85-year-old woman in here and we need to kind of help her with some things. So you need to really be able to talk to people of different ages, different backgrounds, different beliefs. And really be flexible, I think, is a big part of it. So one thing I learned is you can have the people I probably had the biggest impact on might not be the people who got better or the most better. I think the psychological aspect of being able to have them come in and show them how much you care and how hard you're working to get them better, those are the people who kind of like really endear themselves to you.
I would imagine that's kind of an intimate relationship in the sense that you're right there working with someone, you're touching their body, you're talking how they're feeling. So there's that, like you say, a little bit of a counselor therapist role in there, in addition just to the mechanics of it all, right?
Yeah, I like to say we wear many hats here, kind of a psychologist, counselor. This morning I was fixing a hole in the wall, so I was a repairman. So it was a little bit of everything, but I think the psychological aspect of it is just as important as the physical. And we get to know patients pretty well. I have one patient, I think in 6 years, she's been back here 11 times. And like, I know she's, in her 70s, she's almost like my grandmother. I feel like I know her better than some people in my family.
That's awesome. So Ava's wondering, what are the different possible physical therapy fields or jobs? You mentioned like the nursing home, obviously sports. What are some others that you would want to make sure the young people know about as far as opportunities? And maybe the different levels, like including a PTA, like kind of go into that.
Okay. So different areas, like you said, in the school, they'll have PTs in the school. They'll work sometimes with autistic children or patients with disabilities. The hospital setting is a big one. Some for just like people who are there short stay, some for long-term care. Spinal cord rehab is another big one. That was an area I really liked. If I wasn't in here, I probably would have went into spinal cord and neurology. PTs actually can work in like burn units and do burn care. That's another, so like skin care, that type of stuff is an aspect of PT. Let's see, yeah, we have sports, you have nursing home is another one. Yeah, there's quite a variety, really. Cardiac rehab is another like long-term care area. We have some PTs who will specialize like lymphedema. What's the other ones? Like concussion care, so I treat concussions. Vestibular, which is like inner ear issues, or people like with vertigo, we'll treat that also. One of our other therapists, Jessica, she treats babies who have torticollis, it's called. So sometimes they'll come out when they're young and they kind of have a tightness in one neck or kind of a tilted neck. So we'll have, 3 months old in here at sometimes. And PTAs is a huge growing field. So those are physical therapy assistants. That degree is an associate's degree. So you can get that at some community college. We have one of our techs who works for us. She is at Baker College doing her PTA degree. So it's 2 years. You come out after that and you're treating patients. You can't evaluate the patient. So the physical therapist will evaluate and then basically they'll hand off. And then the PTA basically takes over. They do the hands-on treatment. They do the plan of care. It's a really up and coming field, especially in the hospital setting. It's a lot more popular than outpatient, but in our company, we probably have 6 or 7 PTAs.
Yeah, that's one of those jobs I really, really want young people to understand, because really, what is the end term goal? If you like working with the patients, you can do that with a 2-year degree. You don't have to get that doctorate degree. Obviously, you were talking earlier about you're the one that does the care plan, but the PTAs assist you in some of the hands-on care. The average salary is about the mid-50s for a 2-year in Baker. So yeah, at least check that out, young people, depending what your goals are, especially if you're looking around the finance. Now, to help clear up some misunderstanding around the PTA, some people say, well, if I start as a PTA, does that automatically transfer to go into the next level of schooling? It's my understanding they're kind of different ball games. Is that true?
Yeah, they're kind of separate. You can start on like as a PTA and then continue on, but it's not that you still have to complete a bachelor's degree and then get admitted into PT school. You kind of have a leg up as far as what courses you've taken and things like that already. So it's probably easier to get into PT school, but it is kind of a separate almost entity as far as schooling wise.
I think one of the advantages would be, just like you did with athletic training, that you're actually out there working and learning and seeing if you like it before you make that big commitment. So even as a PTA, to get out there, start working in it, see if you like it, then take it to the next level. Does that make sense for some people?
Yeah, absolutely. I mean, I think that's an awesome idea, and that's what we have. Yeah, the one of our techs, she's kind of like, yeah, like I think I'm going to do PT, but I'm not sure. Like PTA is kind of where I'm at right now. So I'm like, yeah, like their PTAs are just as good as PTs. Some of them I've worked with, and they get freedom to almost treat just like we do.
Yeah, and I'm glad that you got to share that. I didn't know you had a 6 or 7 of them just at your organization.
Yeah.
What about, because some of the therapies are similar, like occupational therapy versus physical therapy, and then you have the speech therapists, recreational therapists. Who else do you have at Health Stepson as part of your team? Is it all physical therapists and PTAs, or do you have some other therapists?
Yeah, we're all physical therapists and PTAs right now. Yeah, but we've looked into like occupational therapy as kind of another adjunct to bring on, because there's some crossover there between PT and OT. But yeah, the OTs mostly deal with like upper extremity stuff, if it's elbow, hand, shoulder stuff, and more as far as like preparing the patient for like things they need to do at home or things they need to do. We call them ADLs, activities of daily living. So things you do during your day that you need to get by.
Well, I'm wondering, as we look at kind of having a real person who does this in front of us, what are some of those mistakes maybe that you made along the way, Pat, that you learned from that young people could benefit from?
Yeah, that's a good question. I think probably like as a PT, especially early on, like not trusting myself or not, believing in myself as far as, like, hey, like I have a doctorate degree, like I learned a lot, like, and so like I can do this type of thing. And then not learning from experiences. So like taking things that I saw in athletic training or did or saw someone do on one of my clinicals and making sure that I brought that to what I do. Because on those experiences, like you just got to be like a sponge and soak up as many things as you can from those people. Because They want to teach, they want to help you. So I think my biggest mistake was, maybe trying to do things on my own too much and not kind of using the resources that I had.
Yeah, that's a really good one for sure. We just believe it goes so fast, it's already 11:27. So for two more questions, I'd love for you to kind of give them some of the things that are your favorite parts of your job. Obviously, you mentioned the relationships with the woman who's almost like a grandma to you, but maybe some of the things that are your stressors too.
Yeah, kind of biggest stressors I think are when people don't get better, because we put so much time and energy into helping them get better, and sometimes it becomes personal, and sometimes it's not anything that we're doing. Sometimes it's just they're not going to improve. You can try as hard as you can, and they can try as hard as they can, and they're just not going to get there, and it's very frustrating. So that's kind of like the biggest stressor I get. On the other end of it, stress-wise, is kind of dealing with insurances, and maybe an insurance says, okay, we have to cut this person off, and they're like, well, we're not done yet. They can't do what they want to do yet. And it's what people have to pay to come now because of insurance coverage is a lot more than it used to be. Just because of high deductibles and things like that. So their out-of-pocket costs are higher, and that kind of limits some people sometimes from coming, and that can be bothersome for sure.
Yeah, because you just want to be there to serve, to help, and to know that those are the reasons they're not getting better or able to come at all. That's got to be really, really frustrating.
Yeah.
So this is your final chance. I have a couple of resources I'm going to share with the young people to help them with further exploration. You've done a great job today giving some really great information. But what would be one of those final kind of words of wisdom, Pat, as we close up with our half hour here?
I would say if you think this is a field you want to do, or if you have, even a glimmer of, this kind of interests me, volunteer, shadow, if it's in the hospital, if it's in a setting like this, try to get as much information about the different areas of physical therapy and what it's like. I mean, you can hear from me, it's great, you probably learn a lot, but if you come in here and kind of walk around and see what they're doing, talk to some of our techs who are in college, talk to some of the other therapists, talk to the patients, they love telling their stories. You can learn a lot about the profession and kind of really decide, like, yes, it's for me, or no, I'm not really into it. So I think just be open to kind of what's out there.
Yeah, I know obviously with COVID, those job shadows are probably limited right now, but
sure, yeah.
When the time comes, I guess I just want to make sure these young people know that it's very easy to get a job shadow at a physical therapy clinic. It's literally taking that time to call or, connect with a physical therapy clinic that you've been part of, network, but it's very easy compared to getting even to the hospital to do a job shadow. So just kind of a heads up on that there's no reason that you're not doing it, because usually it's just a phone call, and tell them, your name, what grade you are, that you're looking at this for a career, and that if you could job shadow. So I think they make you sign a HIPAA form when you first get there, a form for patient privacy, but other than that, it's pretty straightforward, right?
Yeah, it is pretty easy. Yeah.
Well, this has been so great. I love learning about careers. I'm a career geek, so this is really fun for me. But students, this is Pat's email address that he's offered to share with you. And so I encourage you to write that down and follow up. Even if you have some questions that we didn't cover today, take the time to do that. He is now part of your network. And I know, as he said earlier, he'd love to answer questions for you. Leah did put a survey into the chat, so you can copy and paste that into your browser. We'd love to get feedback. This is just a 3-week kind of a pilot program to see if this is helpful to you young people. So we really need to hear back of what we could change or add, or if it was good. That will help us in making future decisions. So hopefully you had enough time for that, because I did want to give you 2 more resources. If you like hearing Pat's story, Road Trip Nation actually has some more little video vignettes of people talking about their careers, and there's all sorts of really cool ones. So roadtripnation.com. Got to hover over career exploration and then click interest, and then you can look at careers by categories. So I just think they're awesome. So great resource there. And then onetonline.org is where you can get some of that nuts and bolts of what Pat's talked about today, as far as the education, how much money they make, what the outlook is. Is this a job that's growing or going away? It's very much growing. So some of those practical things, learn more about physical therapy assistants, the difference between occupational therapy, all those kind of questions. You can do some more research on your own by this website. So Pat, it's been awesome to have you today. Thank you so much. We hope that you have a great day, and hopefully we can get students out seeing you again, let this crisis pass, and then we'll be able to reconnect again and have students learn from you.
Yeah, can't wait. Thanks a lot for having me. I appreciate it.
Awesome. Thanks everybody for joining us today. Have a great day.